Welcome, aspiring nurses. Today, we're going to embark on an exciting journey into the world of nursing research. In the next 6 minutes, we'll demystify 2 key research terms that will help start to guide you through the process of conducting nursing research. Let's get started. Understanding key research terms. Today, we'll start by discussing 2 key terms in nursing research: hypothesis and variables. Let's begin with hypothesis. What does hypothesis mean? A hypothesis is an educated guess or prediction about the relationship between variables. It guides the research process and helps us test our ideas. So, how does a hypothesis guide the research process? A hypothesis serves as a starting point for the research journey. It helps researchers narrow down their focus and provides a framework for investigating a specific research question. By formulating a hypothesis, researchers can develop a clear direction for their study and design appropriate methods to collect data. But how does a hypothesis help us test our ideas? Well, once we have a hypothesis, we can systematically gather evidence to either support or refute it. This process allows us to evaluate the validity of our initial guess or prediction. Here's an example. Let's say we have a hypothesis that states, increasing patient education about medication adherence will lead to improved treatment outcomes in patients with chronic diseases. To test this hypothesis, we would design a study where we provide enhanced education for one group of patients while maintaining standard education for another group. We would then compare the treatment outcomes between the 2 groups to see if the hypothesis holds true. So, a hypothesis helps us design experiments or studies to gather evidence. By designing experiments or studies that align with our hypothesis, we can systematically investigate and collect data to support or challenge our initial prediction. This process ensures that nursing research is grounded in evidence and helps us make informed decisions in clinical practice. Understanding the role of a hypothesis is fundamental to conducting effective nursing research. It's an exciting journey that allows us to explore new knowledge, improve patient care, and contribute to the advancement of the nursing profession. So let's now discuss variables in nursing research. What is a variable? Well, variables are the characteristics or factors that can change in a study. They are the building blocks of research and play a crucial role in understanding relationships and making meaningful conclusions. Here's an example. Let's consider a research study about pain management. In this study, we might be interested in investigating how different types of medication affect the level of pain experienced by patients. Here, the independent variable is the type of medication, which we can control and manipulate. The dependent variable, on the other hand, is the level of pain experienced by patients, which is the outcome or result we measure. So, the independent variable is the one we change, and the dependent variable is the one we measure. The independent variable is the factor we manipulate or control to observe its impact on the dependent variable. It's often the cause or predictor of change. In our example, we would administer different types of medication to different groups of patients to see how it affects their pain levels. The dependent variable, in turn, is the outcome we measure and expect to be influenced by the independent variable. However, there are other types of variables. In addition to the independent and dependent variables, there are also intervening variables or confounding variables. Intervening variables are those that come between the independent and dependent variables, affecting the relationship. Confounding variables, on the other hand, are external factors that may unintentionally influence the relationship between the independent and dependent variables. It's important to identify and control for these variables to ensure accurate results. So, by understanding and identifying variables, we can better design our studies and interpret the results. Understanding variables allows us to define our research questions, develop hypotheses, and select appropriate methods to measure and analyze the data. By clearly defining and manipulating variables, we can explore relationships, draw meaningful conclusions, and contribute to evidence-based nursing practice. It's a crucial concept to grasp for conducting research. Variables are the heart of research, and understanding their role is essential for aspiring nursing researchers like yourselves. That's all for now, but please come back for more information on research in nursing. Bye, and I look forward to seeing you again.